Hi everyone, I'm Claire and I'm a pelvic health physiotherapist. So I work with women throughout life, but I'm particularly passionate about postnatal recovery and helping women with their pelvic floor and getting back into exercise and feeling confident in their bodies again. Today I'm going to talk about pelvic floor scars after a tear and what you can do at home to help. So a lot of women will experience an element of tearing with a vaginal birth. So that can be anything from the skin through the pelvic floor and including the ring of muscle around the anus called the anal sphincter. Now, when we have a tear, the majority of tears will be stitched. So we'll stitch back together to allow it to heal, but a scar will form. And scar tissue is generally tighter and a bit thicker than the tissues around it, and therefore that can create tension and soreness. Lots of women will notice this probably when they're trying to have sex again, but it doesn't mean that it has to be like that forever. And there is lots of help out there, and there's lots that you can do yourself. So it's very similar to perineal massage that you may have done before you had your baby, and I'm going to bring a little model of the pelvic floor here. So this is the pelvic floor, and you've got the majority of the muscle sort of here around the anus, but a lot also around the front. Now, when we have tears, a lot of the most vulnerable area is this perineum here between the vagina and the anus. But tears can really be in any part of the pelvic floor. So everyone's different, so it will really depend on you. But for a lot of women, what can help is if you use an oil, and Nessa have a brilliant oil called the Vagina Victory oil, which is completely natural and good to use for this sort of massage. If you pop it on your thumb and place your thumb just inside the entrance and you're thinking about sweeping side to side. Okay, now for you, you might feel, oh, there's a tighter and sore area. And if that's the case, you might want to sweep a few more times over that area because we're working on desensitizing the scar and helping it to recover. Then you might want to do some stretching. Okay, so pop your thumb just inside again, and say if your scar was on this side, so it's feeling a bit tighter and a bit sore there, you're going to pull down towards that area for 30 seconds. Now it should feel stretchy, it should not be agony, it should not be really painful. We're looking at stretchy, okay? And so holding that for about 30 seconds, and then you want to work on the tissues also around it, so working in all directions. Now it's important to note here that for some women, a small percentage, your scar might have overhealed, and we call that overgranulation tissue. Now, if that's the case, your symptoms will be that the scar is really, really sore. It feels raw sort of after 6 weeks. So you may have tried to have sex, but it just feels raw. It's just impossible. And even touching it yourself will feel very similar. If that is you, please do speak to your GP or try and find a pelvic health physiotherapist who might be able to send you in the right direction, because we really need that to be addressed by a doctor. Again, it's not the end of the road. There's lots of help, and then you might see a physio as well. But it's just important to note that actually massaging that tissue isn't necessarily going to resolve it, and I want you to be able to access the right help. We really recommend that if you can spend sort of 5 minutes on that every other day. We don't want to be making you really, really sore, and we wouldn't advise that you do it before 6 weeks, but after the 6 weeks, once the scar's completely healed. But the main thing is, I think, to know there is so much that can be done to help, that you can do it yourself at home. And actually, if you are experiencing pain, and maybe you've done the massage, you've tried your own techniques, please don't suffer in silence. Please do access seeing a pelvic health physio, because we are available and we love to help women with these symptoms, and it's never too late to access help.